Age-related changes in the senior. In this module, you will learn about how human body changes with age. Let us now view the module. The human body is a fine piece of machinery. Its various parts work together to make the body function. From the time a person is born till the time they die, the body changes continuously. The various organs and systems develop from birth to adulthood. Starting from middle age or later, the organs and systems begin to deteriorate. The extent and timing of these changes may vary for every person, depending on various factors such as their lifestyle, genetics, and diet. Let us look at some of these changes that occur in a person's body as they age. Let us begin by learning about how skin changes. With age, the skin loses resilience and moisture and develops dryness. As the tissue elasticity changes, skin wrinkles. In some areas of the aged skin, melanin synthesis increases, leading to pigment spots. While a young adult renews epidermal cells every 20 days, for a senior, this time increases to 30 or more days. This is why a wound heals much slower in a senior as compared to a young adult. The subcutaneous tissue under the skin plays an important role in the body's adjustment to temperature. With age, the natural insulation that subcutaneous fat provides is lost, causing the person to feel cold. As a person ages, the hair becomes sparse and gray. Hair turns gray because of the decrease in melanin production in hair follicles. Nails of both fingers and toes grow slower. The nail plate thickens and becomes yellowish. With age, the fat in the eye sockets supporting the eyes decreases and the eyes sink into their sockets. The pupils decrease to about 1/3 of the size as compared to when the person was 20. They also react more slowly to darkness or bright light. The lens becomes yellow and cloudy. As a result, the sharpness of vision gradually decreases, and focusing the eyes on a nearby object becomes challenging. The vitreous humor inside the eyes also starts to shrink and creates small particles, reducing the clarity of vision. The eye muscles also weaken, which makes it challenging to move eyes in all directions. With age, a person gradually loses their hearing abilities. Among other causes, it is because the ossicle joints between hammer and stirrup develop calcification. This causes diminished vibration of these bones and in turn diminished transmitted sound. With age, the smell perception declines. This is due to loss of cells in the olfactory bulb of the brain and a decrease in the number of sensory cells in the nasal lining. The person may increasingly breathe from the mouth while sleeping, leading to lower saliva production. Due to changes in the trachea and larynx, there may be changes in the person's voice pitch. As a person grows old, respiratory muscles weaken. Changes in the chest and lungs cause diminished efficiency in ventilation and gas exchange. Let's understand some of the changes that occur in the mouth and teeth and taste abilities. In the mouth, the amount of saliva that helps digestion decreases. There is also a gradual loss of taste buds. As a person's teeth fall, they may start to depend on dentures. All these changes have a negative impact on the person's sense of taste, appetite, and nutrition. The changes in the gastrointestinal system of a person, such as an increase in the stomach pH, make a senior more susceptible to gastric irritation and intolerance to fatty foods. The urinary system of a person also changes with age. The walls of the bladder become thick and hard. Therefore, the bladder cannot stretch as much as before and can hold a lesser amount of urine. As a person ages, they also undergo skeletal and muscular changes. They lose calcium from bones and the bones become brittle. Their vertebral discs become thin due to dehydration. Some seniors may also feel less sensation in their feet. A person may lose 1.5 to 3 inches of height every 20 years. Many aged persons presume a stooped forward bent posture. Proximal muscles, including muscles in the shoulders, arms, thighs, and near our spine, also weaken with age. If a person has become inactive with age, their less used muscles may gradually degenerate. Let us look at some of the changes in the circulatory system. In the heart, the left ventricle wall thickens and the left atrium increases. In addition, the valves become thicker and stiffer due to lipid deposits and other factors. The heart contracts more slowly than before. The blood provided by the artery blood flow to the circulatory system also decreases. As a person ages, there are changes in their nervous system and mental faculties. The brain weight decreases by around 10%. The nerve cells gradually deteriorate and die. While the intellectual performance of a person without any brain disorders may remain the same as they age, they may become forgetful and take longer to perform various tasks. Due to changes in the core nervous system, the sense to orient one's body deteriorates. In addition, tactile sensitivity or sense of touch also decreases due to the loss of large number of nerve endings and skin changes. With age, a person may become less responsive to pain. Conditions that are normally painful may only cause minor discomfort in the senior. For example, a senior may not notice a burn. A similar burn may be quite painful for a younger person. As a person becomes old, there are several physical and mental changes that occur. Understanding these changes will help you become more efficient and empathetic when caring for a senior. Let us recap. With age, the skin becomes dry, wrinkled, and may develop pigment spots. Wounds take more time to heal. Hair becomes sparse and gray. Nails grow slower. The eyes sink into their sockets. The pupil becomes much smaller. The lenses become yellow and cloudy, leading to diminished clarity of vision. The hearing abilities reduce gradually. The sense of smell declines. The person may increasingly breathe from the mouth while sleeping. The efficiency in ventilation and gas exchange reduces. The person may lose teeth and their sense of taste may decline, in turn causing loss of appetite and nutrition. The person may become more susceptible to gastric irritation and intolerance to fatty foods. The bladder cannot stretch as much as before and can hold a lesser amount of urine. Calcium is diminished from the bones and vertebral discs become thin. The person may lose height and presume a stooped, forward-bent posture. In the heart, the left ventricle wall and valves thicken, and the left atrium increases. The heart contracts more slowly, and the blood provided by the artery blood flow to the circulatory system decreases. The nerve cells gradually deteriorate and die. The person may take longer to perform various tasks and become forgetful. The sense to orient one's body deteriorates. The sense of touch decreases. The person may become less responsive to pain.